Welcome back to your Pediatric Dentist channel Tiny Teeth Talks. If you are new to this channel, subscribe the channel, and for details of this channel, visit the bio section, or you can also check out my first video. Sorry if there is any mistakes in videos or shorts. Today we will cover other digital imaging with advancement in radiography. First, MRI, magnetic resonance imaging. Magnetic resonance imaging MRI is a non-invasive imaging technique that uses the magnetic fields and radio waves to produce detailed image of the internal structure of the body. In dentistry, MRI is increasingly being used for its ability to provide high resolution images for both hard and soft tissue without the use of ionizing radiation, without the use of X-rays and gamma rays. Coming to the principles of MRI works by aligning the protons in the body's water molecule using a strong magnetic field. The human body is composed largely of water, which contain hydrogen atoms. Each hydrogen atom has a single proton in its nucleus. When a person is placed in an MRI scanner, the powerful magnetic field forces the proton in these hydrogen atoms to align with the direction of the magnetic field. And then radio frequency pulses are used to disrupt this alignment, and when the protons return to their original state, they emit signals that are detected by the MRI scanners, and these signals are processed by a computer to create detailed images of the body's internal structure. This is the image of MRI machine, which include this magnet is the core component that generates a strong magnetic field. Then gradient coils, they produce varying magnetic fields for the spatial encoding. RF coils, which transmit the radio frequency pulses and receive the resulting signals. Patient table, that platform on which the patient lies during the scan. Here there is a operator consoles, the control panel used by the technician to operate the MRI machine. Then this is the computer which processes the signals received from the RF coils to create image. A bore, which is the tunnel in which the patient is slides, and there is a safety system ensure the MRI environment is safe for both the patient and the staff. Coming to the advantages, non-ionizing radiation. MRI does not use ionizing radiation, reducing the risk of radiation exposure to the patient. Means it does not use the X-rays or gamma rays. High resolution images. MRI provide high resolution images in multiple planes, allowing for the comprehensive exploration of anatomy. Soft tissue contrast. MRI excels at differentiating between various soft tissue, which is crucial for diagnosis soft tissue pathologies. Functional imaging. Functional MRI can track the blood flow changes during the cognitive task, providing insights into the brain activity. Coming to the disadvantages, cost. MRI scans are generally more expensive than other imaging modalities. Time consuming scans can take 30 to 45 minutes or longer. Claustrophobia. This enclosed nature of MRI machine can cause discomfort for the some patient. Noise. The machine produces loud knocking noise during operation, which can be unsettling. Metal sensitivity. Patient with the metal implants or devices may not be able to undergo an MRI scan safely. Coming to the applications in dentistry, it is used for cephalometry, which involve measuring the dimensions of the head and face to aid in orthodontic treatment planning. Help in detecting dental pulp, inflammation, and characterizing periapical and marginal periodontal pathologies. Help in detection of the caries and the characterization of periodontal disease. MRI is safe for children and pregnant women, making it a valuable tool for assessing congenital anomalies and brain development. In June 2024, the first ever MRI system dedicated to dentistry, the magnetome-free Max Dental Edition, was introduced at the European Congress of Dentomaxillofacial Radiology in Germany. This system is designed specially for the dental imaging and represents a significant advancement in the field. The second is a nuclear imaging. Nuclear imaging, also known as a radionuclide imaging, is a medical imaging technique that uses small amount of a radioactive material to diagnose and determine the severity of various diseases. It provides unique information that often cannot be obtained using other imaging procedures. Coming to the principle, nuclear imaging works by detecting radiation emitted from the radioactive tracers introduced into the body. These tracers accumulate in a specific organs or the tissue and emit gamma rays, which are detected by gamma cameras. The resulting images reflect the biological process occurring in the body, such as a metabolism, blood flow, and organ function. So a small amount of a radioactive tracers is introduced in the body, usually by injection. The tracer is chosen based on the its ability to accumulate in a specific tissues or organ. As the tracer decays, it emits the gamma rays, and these gamma rays are a form of ionizing radiation that can be detected by the gamma cameras. Now, these gamma cameras capture the gamma rays emitted by tracers, and these detectors convert the gamma rays into the electronic signals. These electronic signals are processed by a computer to create images, and these images reflect the distribution of the tracer within the body, providing the information about the function and the structure of organs and tissues. These are the cameras and gamma rays emitted, and this is the gamma cameras which capture these gamma rays. There are three types of nuclear imaging. First is planar scintigraphy, which produce the two-dimensional images by detecting gamma rays from a single angle. I found this image of the bone scintigraphy image shows radiolucent area in the left posterior mandible showing defect. Then single photon emission computed tomography provide the three-dimensional images by detecting gamma photons from multiple angles. And positron emission tomography PET, it detects pair of gamma rays emitted by positron emitting radio tracers to construct 3D functional images. Basically, planar scintigraphy shows two-dimensional image, SPECT shows three-dimensional image, and PET also shows three-dimensional image but by detecting the pair of gamma rays. Coming to the advantages, functional information provides insights into the physiological function of the organ and tissues. Early detection can detect disease in early stage when they are most treatable. Non-invasive generally involve minimal discomfort and risk to the patient. Disadvantages, radiation exposure. Although the amount of radiation is typically low, it is still a consideration. Cost can be expensive compared to the other imaging modality. Availability, not as widely available as other imaging techniques. Application in dentistry. Nuclear imaging is not commonly used in a routine dental practice but has a potential application in diagnosis and managing certain oral and maxillofacial conditions. It can be particularly used in the cases where conventional imaging techniques are insufficient. Bone scintigraphy used to detect bone infection, tumors, and other abnormalities in the jaws. SPECT and PET can be employed to assess complex cases involving the head and neck, providing detailed functional information. Hybrid imaging, combining nuclear image with the CT or MRI to enhance the diagnostic accuracy. These are some of the references. Stay tuned for the next part, which include computed tomography CT, spiral CT, and CBCT. If you want this PDF or any other PDF, just like, subscribe, and comment your mail ID with the topic, and I'll send you the PDF. New videos on Thursday evening 6 p.m. and Sunday morning 11 a.m. Also, we try to put MCQs according to topics in our shorts with the answers and explanation if needed, which will help you in Viva or NEET exams. Like, share, and subscribe the channel. Thank you.